Health Director, and to my right is Rodney Cates. He's our Emergency Management Director. We're here today to discuss that we do have confirmed 2 cases of the COVID-19 virus in Rockingham County. And now I'll turn it over to Susan Young.
My staff received a call earlier today from the hospital that we have 2 cases here in Rockingham County that have been diagnosed. They are both hospitalized and they are both receiving care currently at this time.
Mr. Cates.
Both of those patients were transported by Rockingham County EMS. A review of the files indicates that our staff did use proper protective equipment. Our trucks were decontaminated following the transport of these patients just for safety precautions, as we have done with many patients. So the safety of other patients and the safety of our crews has certainly been maintained and is currently maintained at this time.
As far as for county operations, we are fully staffed. We feel like that our operations in Rockingham County are essential with our public health department, our Department of Social Services, our community development department. So we are fully staffed. We have staff working, and we're looking out for the best interests of our citizens and our staff by dispersing staff. We are having staff telework. We're having those individuals that come in make appointments at the tents outside. Once it's time for their appointment, then they will be called, or our staff will come out to the car to come get them for any appointments they have.
And I would just like to reiterate everything that we have been saying all along. Please just do your social distancing. If you have underlying health conditions, please stay at home. Just use good cough etiquette and try to be within that 6 feet of social distancing. Use hand sanitizer, wash your hands frequently, and only go out if you really need to go out and do kind of essential things like go get groceries, go to physician's appointments, and just please call your physician, because a lot of physicians' offices currently are doing telemedicine work and they are currently seeing patients by telemedicine. If you do feel sick and feel like you need to be seen by your physician, call ahead and let them know that you are sick. They will advise you what to do. But if you feel like it is a true medical emergency, call 911. You can be transported if you feel it is at that need. But we're asking everyone, please do not clog up the emergency rooms. If you are not acutely ill or you feel like you need to be transported, that option is still available. But just use your resources wisely and just protect each other and look out for each other here in the county, because you may be walking around and feel perfectly fine, but you still may be a carrier, and you could be giving it to someone else in the community that has a lowered immune system, or a newborn baby, or a pregnant mother. So just please, we need to watch out for each other and just all practice and take this very seriously. This is a serious time here in our county, but we are all working very diligently to protect each other and protect our staff and protect you as citizens.
Questions?
We have several questions from Joe Dexter at the Reedsville Review News and Record. Is the source known for both cases, or is it community spread?
We do not have that information currently, but we are aware there is community spread in all of North Carolina. So if it did turn out to be community spread, that would be perfectly a logical thing to be happening at this point.
Joe Dexter, Reedsville Review. Will the county take additional steps and measurements now that positive steps have been confirmed?
Right now, we're following the Governor's Executive Order 121. We have included that in part of our state of emergency, and we'll follow what the Governor has put out.
Joe Dexter, Reedsville Review. How many tests have been taken by Rockingham County residents?
That information is currently unavailable. We have been testing, physicians in our area have been testing, but all the lab results are not feeding back into our state system. All the negatives are not going back into the system currently. That was a state regulation that came down that they would not currently go back in. So we do not have an accurate case count, but we are testing here in Rockingham County, and many people have been tested. Mark
Childry, Star News. Can you narrow down where the 2 cases came from, cities or towns?
To protect the individuals, we do not want to give out any demographic information or any locations of where that could have occurred. We try to protect the families. We try to do a delicate balance of giving enough information and also protecting the families. So we're not at liberty to say right now exactly where that is occurring.
And we have another question from, this is from Susie at the Reasonable Review. Does the public need to understand that there are likely more than 2 cases in the county?
There is community spread in all counties in North Carolina, so it would be, you would think that there probably is more cases. We do not have any confirmation of any but 2 confirmed cases, but as community spread continues, there will likely be more cases all over North Carolina, not just in Rockingham County.
Another question from Susie at the Reasonable Review. Is there a danger of the public feeling a false sense of security when numbers reported are low?
I think we all need to take this seriously. I mean, I feel the governor has taken this seriously. We have taken it seriously here in Rockingham County at the governmental center. I think everyone needs to heed the warning and take this very seriously. If you look at what has happened in China, if you even look at what is happening in New York, in New Orleans, in Denver, there are places, you know, this is occurring, and this is really needs to be taken very seriously, and I feel like we are all taking those steps to take it very seriously.
Susie asked again, obviously, more testing would likely yield more positives. So what's the message to the public in light of the numbers?
It is just, you know, reiterate doing what you need to do to stay at home. The state guidelines for testing are just, if it is to test healthcare workers, people that are hospitalized, and if you have an underlying issue that your doctor will decide that if you need to be tested. But that is the state guidelines currently on testing. It is not to just randomly test everyone.
Maybe just to reiterate the governor's orders of Executive 121, make sure, again, as Ms. Young said, stay at home, but the areas that you can go from March the 29th to April 29th is the post office, gas stations, child care, places of worship with 10 or less gathering, the health care providers, takeout, delivery, drive-through, grocery, pharmacies, hardware stores, office supply stores, vet, pet stores, outdoor exercise, ABC, beer and wine stores, hotels, airlines, buses, taxis, rideshare. Other than that, stay at home.
Okay, I think we have some more coming in. Hold on. Rodney Cates, this is from our Children's Star News. If the county EMS has plenty of protective equipment when they are answering calls and medical calls, do you have enough?
We are currently, we have some at this point. We're currently trying to get other PPE or protective equipment for our staff. And we don't know the magnitude of how far this coronavirus is going to go at this point, so we want to obtain as much as we can to ensure the safety of our responders. We too want to ensure the safety of the rescue personnel. There are 3 rescue agencies within this county, and there are 24 fire departments. So we want to ensure that their security as well through the use of proper protective equipment. So we are trying to get as much as we can to ensure the safety of all.
I think that's all the questions that have been texted by the media. Lance and Susan and Kate, you all may want to give some closing remarks or...
Yeah, just some closing remarks from the county is we want to make sure again that you stay home, you stay safe. Rockingham County is here for you, for the safety, health, and welfare of Rockingham County, the citizens of Rockingham County. We want to continue to provide essential support for you from the government center, and we want to make sure that we always take your needs first. Susan?
And I'm in full agreement with what Lance said, and just remember that everything that is going out is to protect yourselves, your loved ones, the employees that we have here, and just do what you need to do to protect yourself and others. And we will all get through this together, and we will all see a better day, hopefully, in the near future. So just all hang in there and do what you need to do right now, and we'll get to the other side.
Mr. Cates?
The latest protocol that came out from the Office of EMS, it talks about responder safety, and it indicates in there that for responders to treat all patients as if they have COVID-19 at this point. So when we talk about social distancing, that is a key component of that when we're out in the public, if we have to make those essential travels, treat all patients or all people that you come in contact with as though they have COVID-19. Exercise that social distancing to try to enable yourself to be as safe as you can.
We have another question from Susie Spears from the Reasonable Review. Does the fact that surrounding counties and the fact that we have a good bit of traffic and commuting from Guilford, Danville, Martinsville, etc., point out our need to consider there's more positive cases than we can know?
Well, there's no way to know you have a positive case until you get a confirmatory lab. So we could speculate all day long that we have more positive cases, but until we know for sure with a confirmatory lab and we can go from there, we truly cannot know the magnitude.
And Susan Spears and Joe Dexter from the Reasonable Review and Mark Childry from Star News all thank the three of you for helping so much with these details.
Thank you.
Thank you.